is the pancreas. Regarding the anatomy, the imaging investigation, and some anatomical variation. First of all, what is the pancreas? Is a gland of exocrine and endocrine function. Regarding the endocrine function, many cells responsible for the endocrine function for producing different materials, like the alpha cells for glucagon, beta cells for insulin and amylin, and so on. These cells, called the pancreatic islet, secrete the materials through the bloodstream to regulate the sugar levels, while the exocrine function by the acinar cells that responsible for the producing the digestive enzyme secretes into the small intestine through the ducts. The location. The pancreas is a retroperitoneal organ, except the tail has an oblique transverse position, and the tail is the most superior part, while the head is the most inferior. It is located across the posterior abdominal wall and posterior to the stomach, crossing the bodies of L1, L2 vertebra. As we can see here, this is the 12th vertebra, this is L1, this is L2, and this is the pancreas. The tail is the most superior and the head is the most inferior. Another view, this is the stomach. Posterior to it is the pancreas. Again, the tail within the hilum of the spleen. The most superior part and the most inferior part is the head with the uncinate process. The size. It is a J-shaped set obliquely. It is about 15 to 20 cm long, 2.5 to 3.8 cm broad, and 1.2 to 1.8 cm thick, and weighs about 90 grams. Parts. Composed of 4 parts. Head with the uncinate process measure about 23 mm. The neck 19 mm. Body about 20 mm, and the tail about 15 mm. Regarding the head, is a large, flattened right end of the pancreas situated within the curve of the duodenum, has 3 borders, superior, inferior, and right lateral, and has 2 surfaces, anterior and posterior, and has one process called the uncinate process, which projects from the left part of the head towards the left. This is the pancreas, this is the head within the curve of the duodenum, and the inferior portion is the uncinate process. The borders. Regarding the superior border is overlapped by the first part of the duodenum and is related to the superior pancreatico-duodenal artery. This is the superior pancreatico-duodenal artery with its branches, the anterior and posterior branch, while the inferior border is related to the third part of the duodenum and to the inferior pancreatico-duodenal artery. This is the inferior border related to the third part of the duodenum, and this is the inferior pancreatico-duodenal artery with its posterior and anterior branches. And in between is the right lateral border related to the second part of the duodenum, the terminal part of the bile duct, and the anastomosis between the 2 pancreatico-duodenal arteries. Again, the superior border with the superior pancreatico-duodenal artery and the inferior pancreatico-duodenal artery for the inferior border, and the right lateral border for the second part of the duodenum, and the bile duct and pancreatic ducts. Surfaces. Anterior surface is related from above to below gastroduodenal artery, transverse colon, jejunum, which is separated from it by peritoneum. This is the cross section. This is the pancreas, head with the uncinate process, and this is the gastroduodenal artery. Another view. This is the jejunum and anterior border to the pancreas, to the head of the pancreas. Regarding the posterior surface is related to the IVC, the terminal branches or the parts of the renal veins, the right cross of the diaphragm, and the bile duct. This is the cross section from posterior. This is the right cross of the diaphragm. This is the IVC with the left renal vein, and this is the bile duct. The uncinate process is a hook-like extension of the head of the pancreas, is highly variable in size and shape. It passes downward and slightly to the left from the principal part of the head and is related anteriorly to the superior mesenteric vessels and posteriorly to the aorta. Again, this is the head, and this is the inferior projection, is the uncinate process, anteriorly related to the superior mesenteric vessels and posteriorly to the aorta. The neck extend from the upper part of the anterior portion of the head, lie anterior to the union of the splenic vein and superior mesenteric vein to form the portal vein. This is the head, and the continuation is the neck, related anteriorly to the union of the splenic vein with the superior mesenteric vein to form the portal vein. The body, it is elongated, extend from its neck to the tail, passes towards the left with a slight upward and backward inclination, has 3 borders and 3 surfaces. This is the body between the neck and the tail. The borders, anterior border, provide attachment to the root of the transverse mesocolon, superior border related to the celiac trunk over the tubal lymphatic artery to the right and splenic artery to the left, while the inferior border is related to the superior mesenteric vessels at its right end. This is the diagram. Again, this is the uncinate process, head, neck, body, and tail. The anterior border not shown here, but as we said, it has attachment to the mesocolon, and the superior border, celiac trunk, splenic artery to the left, and hepatic artery to the right. Inferiorly related to the superior mesenteric vessels. The surfaces, anterior is a concave, directed forward and upward. It is covered by peritoneum and is related to the lesser sac and the stomach, while the posterior is devoid of peritoneum and is related to the aorta with the origin of the superior mesenteric artery. This is the aorta, left suprarenal gland, and the left kidney, while inferior is covered by peritoneum and is related to the duodenojejunal flexure, cause of jejunum, and left colic flexure. This is the duodenojejunal flexure. Another view. This is the mesocolon, inferiorly and duodenojejunal flexure, and this is the celiac artery with the splenic and hepatic arteries, and inferiorly is the superior mesenteric vessels. The tail, it is narrow left end, lies in the lienorenal ligament together with the splenic vessels, comes into contact with the lower part of the gastric surface of the spleen. This is the spleen, this is the lienorenal ligament with the splenic vessels, and this is the pancreatic tail. The ducts. The pancreas has 2 ducts, the main pancreatic duct and the accessory pancreatic duct of Santorini. The main duct of Wersang begins at the tail and runs to the head, increasing in size, joins the CBD at the ampulla of Vater to open at the second part of the duodenum. It has less than 3 mm in diameter, while the duct of Santorini, it is the distal part of the dorsal bud duct and drains via the minor papilla into the duodenum, 2 cm proximal to the ampulla of Vater, and occasionally communicates with the main duct. This diagram shows this is the main pancreatic duct, begins from the tail to join with the CBD, opens at the hepatopancreatic ampulla at the major duodenal papilla, and 2cm proximal to it is the minor duodenal papilla, in which the accessory pancreatic duct open. This is the accessory pancreatic duct. The blood supply, the arterial dividing into the head and neck, supplied by branches from the superior and inferior pancreatico-duodenal arteries. This is the superior, posterior, and anterior, as we said, with the anastomosis with the inferior pancreatico-duodenal artery with its anterior and posterior branches, while the body and tail pancreatic branches from the splenic arteries, which is the right dorsal pancreatic artery, left dorsal pancreatic artery, and the coda pancreatis and pancreatica magnus. Regarding the venous drainage, and tail drain to the splenic vein, while the uncinate process and lower part of the head drain to the superior mesenteric vein, and the upper part directly to the portal vein. Lymphatic drainage drain into 5 main nodal groups. Superior nodes drain the upper half of the head of the pancreas. The anterior nodes drain to the prepyloric and infrapyloric nodes. Inferior nodes drain to the superior mesenteric and periaortic nodes. Posterior pancreatico-duodenal nodes drain into right periaortic nodes, while the splenic nodes drain into the intercilo-mesenteric lymph nodes. Now regarding the imaging investigations, plain radiograph of the abdomen, ultrasound, CT, MRI, ERCP, angiography, and venography. First, the plain radiograph of the abdomen. It is of limited role, only detect if there is punctate calcification in case of chronic pancreatitis, calcification in case of chronic pancreatitis, or there is a sign in case of acute pancreatitis called the colonic cutoff sign. This is the transverse colon, and this is the colonic cutoff sign. The ultrasonography, it is widely available, easily accessible, repeated often as necessary, cheap, no ionizing radiation, and another causes of acute abdomen can be excluded. Entire gland can be seen only in 60%. The pancreas is slightly echogenic than liver and has homogeneous appearance and increasing in echogenicity while increasing in age due to fatty infiltration. This is the head, about less than 30 millim. This is the body, less than 20 millim. This is the tail. And this is the vertebral column. Anterior to it is the IVC with the aorta, superior mesenteric artery, portal vein, and the splenic vein. Another cross section, this is the left lobe, and the splenic vein used as a landmark to see the pancreatic body. And in the head, we can see the gastroduodenal artery, CBD, hepatic artery, and posterior to them is the IVC. From it, there is the left renal vein, and which comes anterior to the aorta. And this is the tail. The pancreatic duct is seen in about 80% of cases within the gland, closer to its anterior surface. It is best seen in the central portion of the body. It measures approximately 1.5 millim in the tail, 2 millim in the body, and 3 millim in the head. This is again the splenic vein, portal vein. This is the head, the body, and this is the pancreatic duct. CT, pancreas must be studied on sequential CT slice because its oblique position. Tail seen splenic hilum on the highest slice. Uncinate process is the lowest part. the normal thickness, the head about 2 cm, the neck 0.5 to 1 cm, body and tail 1 to 2 cm. The pancreatic duct is visible in most cases. This is a cross-sectional CT. From posterior, this is the vertebral body. This is the left cross of the diaphragm, anterior cross of the diaphragm, right kidney, left kidney, superior mesenteric artery, the aorta, the IVC, left renal vein, superior mesenteric artery, uncinate process, the head, body, and tail. And this is the liver, gallbladder, this is the transverse colon, and this is the spleen. This is coronal image. This is the liver, stomach, small bowel, and in between is the pancreas. And this is also the cross section, and this is the pancreas. MRI, superior soft tissue contrast, even without IB contrast. On T1 weighted image has the highest T1 signal of all abdominal organ. This is T1 image. On T2 weighted image, slightly hyper intense in compared to the adjacent muscle and used for depicting the anatomical ductal anatomy. This is the fin 9 is the duct. Again, this is cross section. This is T1 showing the part of the and the tail. And this is T2, clearly you see the duct. MRCP, it is non-invasive and sensitive technique for evaluating the biliary and pancreatic ductal system. This is the main pancreatic duct joining the with the CBD at the sphincter of OD. The CBD from union of the common hepatic duct along with the cystic duct. ERCP is a diagnostic and interventional procedure technique using both endoscopy and fluoroscopy for examination and intervention of the biliary tree and pancreatic ducts. It involves passing an endoscope to the descending duodenum and subsequently cannulating the ampulla of water, after which contrast can be injected. Pancreatic duct measurements are higher on ERCP than on MRCP and ultrasound because they distend as they are filled with contrast on ERCP. This is the endoscope passing down through the duodenum. This is the main pancreatic duct. This is the small accessory pancreatic duct. And this is the CBD. Another view. This is again the endoscope. And this is the main pancreatic duct along with the CBD. Angiography of the pancreas. These will be demonstrated by CT or MR angiography. First, we take the schematic drawing of pancreatic arterial anatomy through the celiac artery, giving the splenic artery and the common hepatic artery. From the splenic artery, the dorsal pancreatic artery and the great pancreatic artery. And from the common hepatic artery, the gastroduodenal artery, giving the superior pancreatico-duodenal artery, which gives the posterior and anterior branches. And from the superior mesenteric artery, the inferior pancreatico-duodenal artery, which give the anterior and posterior branches. This is the angiography through the celiac arteriograph. This is the catheter through the celiac vessel. This is the dorsal pancreatic artery, great pancreatic artery. This is the superior pancreatic duodenal artery, its posterior branch, and this is the anterior branch. While this is the inferior pancreatic duodenal artery, this is angiograph through the superior mesenteric artery. This is the inferior pancreatic duodenal artery with its posterior and its anterior branches. Venography of the pancreas. This technique is sometimes undertaken for venous sampling to identify the site of hormone-producing tumor. A transhepatic approach to the portal, splenic, and superior mesenteric veins is used. Now, in dealing with the variation in pancreatic anatomy. First, the pancreas deficit. About 4 to 10% of population, most common congenital anatomic variation of the pancreas, failure of fusion of the dorsal and ventral pancreas result in the anterior superior part of the head, body, and tail draining via accessory papillae, while posterior inferior part of the head draining to the ampulla. This is the normal pancreatic duct. This is the main pancreatic duct, and this is the accessory pancreatic duct. While this is in pancreatic diaphyseum, we have the dorsal duct, and this is the smaller ventral. Risk of acute pancreatitis due to 80 to 95% of pancreatic fluid drain through a relatively small minor papillae. This is an MR image, shows the main pancreatic duct, the dorsal Santorini duct. This is the dorsal Santorini duct, draining separately into the minor papillae, while the common bile duct joining the smaller ventral pancreatic duct at a more inferior level and drains into the duodenum through the major papillae. Another variation is the annular pancreas, is a rare condition where the ventral part incompletely rotates, leaving a segment of pancreatic tissue surrounding the second part of a duodenum. This is the annular pancreas, in which the ventral pancreas encircles the second part of the duodenum, in which the duct of the ventral pancreas makes a turn around the duodenum and merges with the main dorsal duct in a normal fashion to form a Wirsing duct and drain into the major papillae. This is a contrast-enhanced CT, showing this is the duodenum, air within the duodenum, and this is the pancreas, annular pancreas surrounding the duodenum. While another CT cross-section without contrast, also this is the duodenum, and this is the pancreas. This is the baryomeal, showing slit-like smooth narrowing of the second portion of the duodenum. No gastric distension or mechanical obstruction is present. Pancreatic rest or ectopic pancreas, also known as heterotopic pancreatic tissue, most are completely asymptomatic. Most common site in the wall of the duodenum, jejunum, and ileum. This is an abdominal CT. This is the normal pancreatic tissue, and here we see a lobulated tissue mass, the mesentery, and with similar feature to the orthotopic pancreas. Agenesis characterized by absence of a critical mass of pancreatic tissue, or in rare cases, the pancreas is totally absent. This is an enhanced axial CT in patient with dorsal agenesis of the pancreas, show presence of ventral pancreas, and this is just the ventral pancreas present, while here the total absent of the dorsal pancreas. Thank you.
يعني مشكلة الجواب موجود.
إذن هذا مو كويز يعني. راد لي تفتحين شو اسمه اما تشات وتخليه على الأجوبة. افتحي الشات وخليه على الأجوبة. شات جوا من الزوم من الزوم. لو ما تقدرين تتحكمين بيه انت.
يعني هسه انا فتحت الشات بس ما اعرف طلع يعني على
ما طلع. استاذ رعد ما يطلع استاذ رعد. هو خلينا نمشيه هالشكل، خلينا نمشيه اليوم هالشكل.
يلا
احكي انت.
يلا احكيهن بابا احكيهن.
Okay, this is an ultrasound image showing A, this is the portal ones. B, this is the splenic vein. C is the superior mesenteric artery. D, aorta, and E is the left renal vein. Okay, name the examination. This is barium meal. What is the anatomical variant? This is the anatomic annular pancreas, slit-like narrowing the annular
Not the
pancreas.
second part of the duodenum.
CT image cross-sectional. Number 1 is the pancreatic body. 2, pancreatic head. 7 is the hepatic artery. 9, superior mesenteric vein. 10, superior mesenteric artery. Gallbladder, first part of the duodenum, and left renal vein.